Okay, February is National Heart Awareness Month, and of course, Friday is National Wear Red Day, and it's in honor of women and heart disease. So we're talking with Dr. Saima Hussein from McKay Hospital up in Ogden. Doctor, thanks so much for joining us.
Thank you for having me.
Well, we want to talk about myths that are associated with women and heart disease, and sometimes things can get misconstrued, and people don't quite understand heart disease as it relates to women. So we want to talk about that today. We want to talk specifically about 5 myths, and one of them is that the first one, I suppose, is that it's always considered a men's disease. That's not the case.
No, that's not true at all. Heart disease is the leading one killer in women.
Okay, and then the other thing people would say is, well, I'm very young. I'm not an old person, so I'm safe, right?
That's not correct either, because we have to keep in account what risk factors the person has, what's the family history. So age is not a guarantee that one may not have heart disease.
Well, on that note, in my family, my wife is in her 50s. She's not old. She's healthy. She's active. And yet last year she had heart surgery. So it hits home for me to know that that's how close it can be and how quickly things can happen. The other thing is people think, well, I'm in good shape. I work out. My heart health is fine. That's not always true.
It always helps to have a good lifestyle, exercising, eating healthy. That always helps. But other risk factors like hypertension, high cholesterol, diabetes, family history, they play a huge role.
And then what about the people who say, well, I would have some kind of symptoms. I would know if I have a heart problem. That's certainly not true either.
Yes, that's not true, because women specifically, they present with very vague symptoms, not the classic symptoms that the men present with excruciating chest pain. And that kind of delays the care that women get, making it more lethal for women.
And the other thing that I think that myth number 5 would be, people think it doesn't run in my family. So if it doesn't run in my family, I'm protected. But that also is a myth.
Yes, that's a myth too, because one may have a great genetic profile, but the person may have other chronic conditions like hypertension, diabetes, being overweight, smoking. Postmenopausal women, they tend to have heart disease more. So those are the conditions that one has to pay attention to.
Well, certainly good information. I wish we had a little more time. Dr. Saima Hussein from McKay Hospital, we appreciate it very much. And we want to thank you and all your colleagues at Intermountain, because we know they are a leader in heart health. So thank you so much for joining us.
Thank you.
Okay, we'll toss it back to the studio. Don't forget to wear red on Friday, guys.
Oh, I'm all for that cause. Dave, thanks so much. Good information.